Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome back. This is Dr. Jacobs. In this video, I'm gonna go over how to diagnose plantar fasciitis. So there is several types of fascia, superficial and deep fascia. And when we talk about the plantar fascia, we talking about a shock absorption that actually look like this. It's like a bow in the bottom of your feet. And the function of it is it's like shock absorption. It actually provides support for your arch and decrease the tension on the bone. So when you have a weight bearing on your foot, it's kind of help your joint not to take all this pressure on your metatarsal and heel bone. So this is the foot as you see, the top of your foot and the leg bone. So we have the plantar fascia is actually right on the bottom here. And you can see it here, those like a kind of yellowish tissue. That's the plantar fascia. So it's attached here from the calcaneus and go into your metatarsal. That attached to the metatarsal. So when you apply pressure or putting weight on your heel or your foot, that bow kind of tissue is actually cause distribution of the weight and evenly and a kind of like a cushion, so you're not feeling pain or discomfort on your joint for taking your whole body weight bearing on it. So I personally had plantar fasciitis before, and I was able to treat it successfully. And I will share with you in the other video the 3 powerful effective treatment to get rid of plantar fasciitis. I will leave the link for that video underneath this video. To diagnose plantar fasciitis, you actually usually experience heel pain, and also you experience stabbing sharp pain in your heel or your plantar part of your foot with your first steps in the morning. So acute early stages of plantar fasciitis, as soon as you wake up, you will experience a sharp pain in your feet as soon as you put weight bearing on it, and that pain decrease over time with some walking or movement. So some patients usually experience 5-10 minutes in the morning, and it starts to subside as long as you continue walking on your feet. But with chronic condition, the length of the time of the pain of the sharp pain that will be elongated. That's indicative of the severity of the plantar fasciitis. So usually pain decrease with movement, and when you sit for prolonged time and you start taking a few steps after prolonged sitting, your pain will increase again and subside with movement. With chronic condition, I had patient, and I personally had it throughout the day until I get rid of the root cause of plantar fasciitis. And as you see here in this image, the heel, you start to have inflammation, micro tear in this area. So that bow does not provide the enough shock absorption that's supposed to provide. And I will leave link underneath this video for the 7 surprising causes for plantar fasciitis. It's so important to understand those causes so you can treat the root cause of plantar fasciitis. And also I will leave a link for the 3 powerful treatment for plantar fasciitis. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.